2 o'clock, so I'm going to go ahead and get started. So good afternoon, everyone. Welcome to today's presentation, Facilitating Rural Access to Quality Health Information through Little Free Libraries. In the NNLM series overall, the series runs through November 6th through November 21st. So my name is Tiffany Chavis, and I am the Outreach and Education Librarian for Region 1 of the NNLM out of University of Maryland, Baltimore. I will be your moderator for today's session. From here out, I'm going to go ahead and turn off my camera in hopes of avoiding technical difficulties. So since some of you are first-time attendees to an NNLM webinar, I first want to tell you a little bit about the NNLM. The National Institutes of Health is the nation's leading medical research agency. The National Library of Medicine is an institute within the NIH. The NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. The NNLM, it stands for the Network of the National Library of Medicine and was established back in 1965. The NNLM is the outreach and education arm of the National Library of Medicine. The network operates out of 7 regional medical libraries, or what we call RMLs. The RMLs offer training and funding opportunities to support equal access to biomedical information. The goal of the NNLM is to advance the progress of medicine and improve public health by providing U.S. health professionals with equal access to biomedical information and improving individuals' access to information to enable them to make informed decisions about their own health care, their own health, let's say. So as I mentioned before, there are 7 regional offices of the NNLM, also known as regional medical offices. Each office is located at an academic medical library that serves states within that region. Our work primarily focuses in 3 areas, which are training, network access, and funding. We offer access to NNLM network of libraries and other organizations. We offer free training to librarians, health professionals, and the general public. And finally, we offer funding for health-related projects such as health information outreach, health equity, many projects around the digital divide. Okay, so the next webinar in our Rural Health webinar series is Graphic Medicine Discussion, The Most Costly Journey, and will be held on November 12th at 2 p.m. To learn more about this webinar and to register, you can follow the link, which I will post, which I will put in the chat for you. And from here, I am going to turn it over to our speakers from the University of Florida. We have Margaret Ansell, Jane Morgan Daniel, and Lauren Atkins. Thank you all so much for being here with us today.
Hello. Welcome everyone. We are going to be discussing facilitating rural access to quality health information through our Little Free Libraries project. We are from the University of Florida's Health Science Center Libraries, and we are presenting on the recent collaboration between our library and the Okeechobee County Public Library to increase access to quality health information in rural Florida through Little Free Libraries. Okay, so, whoops, not that one. There we go. So a little bit more information about us. So I'm Lauren Atkins. I am the liaison librarian to the College of Pharmacy here at UF. My colleague's Margaret Ansell. She is the nursing and consumer health liaison librarian here. And our colleague Jane Morgan Daniel, who is the community engagement and health literacy librarian. So we are very happy to be here today to talk to you all about this. Nope, too fast, too fast. Sorry. Okay, so our objectives for today. So today we are looking to discuss how to assess the needs, especially the health information needs of your community, using publicly available data. We hope that you will be able to identify potential community partners for library outreach projects, develop health information training for health and social service providers, as well as hopefully brainstorm creative avenues to share health information with the public. No, sorry. Let me go back. Okay, so our session outline, so we're going to talk about our collaboration with the Okeechobee County Library. We're going to go more in depth about our Little Free Libraries project, and then we're going to transition to helping you plan your own rural health information outreach project. We're going to talk about how you can assess your community health information needs, identify potential community partners, develop health information training for health and social service providers, as well as how you plan to disseminate health information with the public. And we're also going to be taking time to answer your questions, and we're excited to do that. So right now, I'm going to hand it over to my colleague. I'm sorry, it keeps skipping quickly, so I apologize for that. And I am going to hand it over to my colleague, Jane Morgan Daniel.
Thanks, Lauren. I'm also trying to get the slides to work. Sorry, 1 second. Okay, here we go. That took a moment. Sorry, we're taking over remote control of someone else's screen. Okay, so now we are going to provide an overview of our Little Free Libraries project. So the idea for this project formed during the Florida's Sunshine State Library Leadership Institute in 2019. And there was a representative from Okeechobee County Public Library in Florida, and they gave an amazing presentation on their library's plan to collaborate with a local nonprofit to build 30 little free libraries for rural Okeechobee County residents in Florida. And this served as the inspiration for collaboration as librarians from Okeechobee County Public Library and the University of Florida's Health Science Center libraries realized that they had much to offer each other. So OCL, which is going to be the abbreviation we're using for Okeechobee County Public Library, OCL had been interested in developing more health information outreach services, and UFHSCL, which is going to be the abbreviation we're using for the Health Science Center libraries today, had been looking for ways to support rural health in Florida to align with our university's overall mission to improve rural health in general. So we decided to collaborate on an All of Us Community Engagement Project Award proposal through what was then known as the Network of the National Library of Medicine's Southeastern Atlantic region. And we aim to improve access to quality health information in rural county communities through the innovative Little Free Library system. And thankfully, our proposal was a success, and our funded project actually ran from January to September 2020. In addition to my co-presenters today, our project team included leadership from both the University of Florida's Health Science Center libraries and also the Okeechobee County Public Library. And this was to ensure administrative buy-in and support for the project. The overall project goals were to improve Okeechobee County residents' access to vital health information, to improve health literacy skills so that residents felt empowered to make well-informed health decisions, and to encourage participation in All of Us. And the project's objectives were to add 3 health information education elements to the Little Free Libraries. So the first objective was to purchase or print consumer health and health literacy resources for the Little Free Libraries, as well as materials promoting participation in All of Us, which is the research program which seeks to accelerate and incorporate diverse populations into medical research. The second objective was that UFHSCL would run a Train the Trainer workshop for the public library to support the development of their health reference services. And the third objective was that Okeechobee County Public Library would collaborate with their county health department to host weekly health reference hours at the Little Free Libraries on a rotating basis. The first step of the project was identifying the demographics of the community to better understand their consumer health needs, to uncover accessibility issues, and to identify underserved population groups. So we used different sources to compile this information. The first was census data, which illustrated that in addition to being a rural community, many people had no internet access at home. They live in poverty, and many of them have not graduated high school. And additionally, Okeechobee County has a number of veterans, older adults, and people who identify as Hispanic or Latinx, Black or African American, and some who identify as Native American or Asian American. Next, OCL looked at their recent circulation data to find out which health topics were the most popular. In addition, Okeechobee County Public Library met with members of their local health department and organizations that were centered on services for agricultural workers to learn more about the types of issues that are affecting their local rural communities in terms of their health. OCL also met with their county health educator who reached out to school nurses to find out about specific medical concerns amongst community youth. The team also reviewed the most recent County Health Improvement Plan, which was compiled by the State of Florida's Department of Health. By analyzing data gathered from the national, state, and local levels, our team was able to prioritize the purchase of consumer health resources for specific population groups. So 6 priorities actually guided our book selections for the Little Free Libraries. We focused on, don't know why the slides are doing that. Let me try and go backwards. Okay, that's the right slide. So 6 priorities guided our book purchases. We focused on books in English and Spanish, tailored for African Americans, Asian Americans, Hispanic and Latinx people, and Indigenous American populations where possible. And we looked for diverse and positive representations of people identifying as disabled, LGBTQ+, veterans, rural residing, and also caregivers. In terms of age range, we bought a number of children's books as they're most likely to have pictures and to be written using plain language, and also to be written using lower reading grades. But we also bought books for other age ranges too, and then lower price materials were also prioritized so that we could purchase as much as possible with the grant money. Okay, here are some of the Spanish language resources that we purchased. And it was challenging to find recently published consumer health resources for children in Spanish due to a lack of availability from vendors. Despite this, we still managed to actually find a good number of books. And then we also identified and purchased resources for several underserved population groups in the community, including veterans, LGBTQ+ people, and individuals with disabilities. We ordered lots of pamphlets, brochures, and posters and bookmarks and printed others out, including many from the National Library of Medicine. And the team also purchased technology to assist OCL with providing health reference outreach services in the community. So some important items that were purchased included a portable printer, 4 Chromebook laptops, and 2 Wi-Fi hotspots with unlimited data plans. The hotspots were chosen because many Okeechobee residents don't have access to the internet at home. And additionally, we registered the Little Free Libraries with littlefreelibrary.org, and we received charter signs, and we got our Little Free Libraries added to the organization's online map so that they were more easily findable. However, due to the timing of the grant coinciding with COVID-19 and the pandemic, no in-person health reference sessions actually ended up taking place at the Little Free Libraries. Instead, the team had to pivot their ideas, and live virtual health reference sessions and readers' advisory services for health materials were offered for OCL patrons. But this was all done virtually and online, and this provided a positive alternative use for grant-funded technology and materials. And then in terms of marketing, OCL very successfully marketed the Little Free Libraries and the virtual health reference sessions through both physical and digital flyers, as well as local news outlets and online platforms like Facebook. For the project's second objective, UFHSCL librarians developed materials for a Train the Trainer workshop for Okeechobee County Public Library employees, as well as local county health department educators. And this training took place in July 2020, and we had 8 participants. The morning session covered the following topics. We talked about how to recognize patrons with limited health literacy, how to understand the role of librarians in health reference interactions, how to apply tailored strategies for conducting a successful health reference interview, evaluating health websites for quality, and accessing and using authoritative online consumer health resources to find information to address patrons' health queries. Sorry, I'm going backwards. Okay. And then the afternoon session focused on skills to develop outreach programming, including strategies for successful health tabling and health information marketing. We also talked about how to convey to community members the benefits of participating in medical research in general, and how to join the All of Us research program. So some of the NLM resources that were discussed excuse me, and shared included resources about clinicaltrials.gov, resources about what was then known as Genetics Home Reference, which has now been discontinued. And all of that information has been incorporated into Medline Plus. Information about the resource, which was then called Pillbox, which has now been discontinued, and then also Toxtown, also now discontinued, and I believe incorporated into Medline Plus too. To see whether the training day increased participants' perceived ability to navigate health information online, the eHealth Literacy Scale, otherwise known as the eHeals self-assessment, was administered before and after the workshop through an online link to 2 Qualtrics surveys. For some reason, it looks like my Zoom is crashing. I might need one of my colleagues to take over remote control to change back the slide to the previous one, if that's possible.
Give me 1 second, I'll do it.
Thank you. It's difficult, Maggie. You have to kind of press the forward button twice to get the slide to move, but sometimes it skips. Perfect, thank you. And so these were the eHeals responses. So 5 of the 8 participants completed both the before and the after eHeals survey. The participants' average total score before the workshop was 3.1, which stands for unsure and undecided. And then following the workshop, the average total score increased to 4.2, which stood for useful and important and agree. Next slide, please. Thank you. From the very beginning, this project was intended to empower Okeechobee County Public Library to engage in consumer health information services and to kickstart their efforts by providing training and resources. The staff are now equipped to host weekly in-person reference sessions at various Little Free Library locations around the county as part of their outreach efforts. And staff also utilize these resources to support virtual reference, ensuring that all ensuring that all patrons can access library assistance regardless of their location or ability to travel. OCL staff continue to collect data on reference transactions and material use statistics and are using this to determine which Little Free Library locations merit permanent Wi-Fi hotspots, regular library outreach services, and to schedule health information programming. The Little Free Libraries have become an important resource, especially for lower income rural families in Okeechobee. There are currently 7 Little Free Libraries in Okeechobee County with a goal of eventually establishing 15. And another indicator of community impact is the high usage of the items from the Little Free Libraries. So since the project started, over 2,500 items have been circulated related to health among the 7 Little Free Libraries. In terms of ongoing maintenance, the Little Free Libraries are checked monthly by Okeechobee County Library staff, and they inspect the Little Free Libraries for wear and tear. And the OCL librarians monitor and restock the health resources monthly, and any materials that are contributed to the Little Free Libraries by community members are kept for circulation. The public library also continues to maintain relationships with other community partners to support their health information services, having worked with the local Rotary Club and the County Parks and Recreation Department to create a story walk to attract local families to Little Free Library locations. Story Walk is an international project in which laminated pages from children's books are installed along local outdoor trails using wooden stakes. And this story walk in particular was designed by the public library to promote health and literacy through active mobile engagement. And the OCL team also presented their health information services as well as information about the All of Us research program at a local gathering of nonprofit community-focused organizations. And then, of course, the relationship between the University of Florida Health Science Center libraries and OCL also continues. So we're available to provide virtual and telephone support to assist with complex health reference questions received by OPL. And then HSCL librarians also keep OCL staff up to date about new sources of freely available authoritative online health information relevant to their needs. Now I'm going to hand over to Maggie.
All right. Yes. So you've now seen an example of how we've partnered with rural community organizations to establish health information and resources. Now we're going to help you make your own plans to share health information with a rural community. In the email confirmation for this webinar, you should have received a worksheet, but if you don't have that handy, I'm going to share it in the chat right now because it's a necessary tool for the next part of our presentation. This worksheet outlines, as you've seen in the slide here, 4 elements of planning health information outreach. Number 1, assessing community health information needs. Number 2, identifying community partners. Number 3, training health and social service providers. And number 4, brainstorming ways to disseminate health information. So let's get started.
Thank you, Maggie. So I'm going to talk about the first element on the worksheet for planning health information outreach, which is assessing community health information needs. And the Little Free Libraries project is a great example of how librarians can use their local knowledge as well as publicly available data gathered from the national and state levels to help plan and conduct outreach projects tailored for local population groups. So as the community engagement and health literacy librarian at the University of Florida Health Science Center libraries, I try and keep up to date with information sources that assess or indicate local health needs for a few reasons. Thinking about the individual level, when I'm tabling at health information events, we do a lot of tabling at local health fairs, for example, it means I can be pretty sure that the information I'm disseminating is actually relevant to a significant subset of the population that I'm meeting that day. And then in terms of collaborating with local health organizations and nonprofit groups, which Lauren will talk more about later, I am more likely to be aware of their organizational goals and objectives because they're typically based on evolving local demographics, and health needs. And then finally, of course, if I see a health outreach grant related opportunity to apply for, being aware of local health data can provide a strong supporting basis in terms of evidence of need for that grant proposal. So in this section of the webinar, I'm therefore going to highlight some of the information sources that I use to keep up with current local health trends in Alachua County, Florida, which is where the University of Florida's Gainesville campus is based. So I hope that some of these ideas will inspire you to look for similar resources in your own local areas that you could use to begin assessing your community's health information needs. Census demographic data can be really useful in terms of a source of information, and the last iteration of the census was in 2020. So the types of data you can find at the county level and also the zip code level are educational attainment and school enrollment, which can be really helpful for deciding what reading grade levels to aim for any information resources that you purchase and try and disseminate. The census data helps you understand which kind of industries people work in, which of course is extremely useful for rural areas when a lot of people may be working in sectors like agriculture or manufacturing. And you can actually look up and do some research on which kinds of health challenges are typically associated with these industries. And then also through census data, you can see the number of people who identify as disabled and which categories they feel their disability falls under, such as mobility, hearing, or cognitive. And then you can also see the percentage of people who have health insurance and who are not insured, as well as the language that people speak at home. And this can be super helpful for considering non-English language resources and which ones you should prioritize. You can also find out which country people moved from if they weren't born here, the number of veterans in the community, the number of people aged 65 plus or older, and then of course race and ethnicity data so that you can make sure any resources that you disseminate are representative of the local community. And then, as I mentioned earlier, the data on computer use and internet access at home is also useful. For example, with our Little Free Libraries project, this helped us to justify the purchase of mobile Wi-Fi hotspots and printers. You should also look for state health department information resources. So for example, in Florida, we have the Florida Health Charts Community Dashboard, which is a community health assessment resource toolset. And this resource collates data from state level surveys, secondary data from nonprofit associations, aggregated health records data, and school health services data, among many other sources. And the types of information that can be useful for us as librarians include data on poverty levels, chronic disease, environmental health, mortality, infectious diseases, births and deaths, maternal and child health, and then also behavioral risk factors like alcohol consumption. Other types of resources to look for include community health assessments and community health improvement plans. Community health assessments can be state, tribal, local, or territorial level, and they're usually conducted by health authorities. And they tend to collect data on communities' health needs and issues. And the community health assessments can lead to the development of a community health improvement plan, which helps local authorities identify priority issues for action. So in Alachua County, we actually have an annual community health assessment that takes place, and then a community health improvement plan that's linked to that, that's updated every 3 to 5 years. And when you're looking at these county health improvement plans, useful information to look for can include decisions that have been made on strategic priorities related to health and wellness. You should also look for health-related objectives and performance measures, and then also at which community organizations are listed as being involved in the community health improvement plan process. And if you can, it's a really useful process to try and become involved in. So as a community engagement librarian, I've actually attended some local community meetings for the CHIP process, And I was able to connect with a lot of other community organizations who may become partners on projects in the future. And you might also find that your local health institutions have community improvement plans, like this one from the University of Florida's Shands Hospital. So information that it can be helpful to look for includes prioritized health needs, where resources are being allocated in terms of expanding services and programs. And again, as always, look out for potential community partners from the healthcare system. And then Shands Hospital even has a needs assessment platform, which I was excited to recently find. So this resource actually tracks data on progress towards goals, such as Healthy People 2030, which is a national set of disease prevention and health promotion objectives. And it also breaks down hospitalization and ER data, as well as health needs by zip code. And then finally, nonprofit organizations might also produce a community resource guide like this one for Alachua County. And this can be very helpful as it details low cost or nonprofit health services, the language availability of services, and also potential community collaborators. And so I'm now going to hand over to Lauren to talk about community partnerships. Thank you.
Okay, so community partnerships are some of the strongest and most helpful connections that libraries can create, as we all know. While there's a long list of benefits, I'm only going to name a few. When your library team develops these community partnerships, your health outreach projects can be more impactful for a variety of reasons. The community partners may have knowledge of the community and types of resources that would be beneficial to them, which would also help the planning process. They may have additional funding sources to help with the project. We all know that money can be very limited in different pots, so finding another pot is helpful. And with these successful partnerships, they may be able to connect you with other community partnerships, which will allow you to promote library resources and services, especially consumer health resources, as well as promoting health literacy on a much larger scale than you had initially envisioned. So in this section, we're going to go over some considerations and how to identify potential community partnerships. So the first component of establishing community partnerships is assessing the involvement of your institution. So some questions that your team should look at are, does your institution currently have any health outreach programs or initiatives? How are these programs structured? How are these programs embedded into the colleges? And even, are there partnerships with certain classes that do community outreach? The next thing you should consider is, what is the relationship between the library and institution? Are there funding opportunities for these health outreach projects? Does the institution support library services and projects? Does the institution support and encourage committees and teams that focus on community engagement and health outreach in general? How established are these communities? Also, how are they advertised? Are they advertised on your institution's website? Do they have a presence? And can they be easily found? And some unfortunate things to consider is, does your institution discourage certain health outreach programs due to the particular population group being served or helped? Okay, so for potential partnerships, here are some of the groups that you can look to collaborate with. Um, so for example, local government agencies, for example, the Department of Health, or Department of Health representatives, local libraries, community centers, civic centers, local religious organizations, local charities and nonprofits, local educators and creators and artists, as well as other community stakeholders and leaders. However, don't just stick to this list. These are just some ideas. Take a look at your community and see what groups are active and what type of outreach are they doing. And then you can think about how you could partner with them, and you can think about how the library could help your outreach goals for the community as well as theirs. In regards to connecting and finding these partnerships, I'm not above a cold call or a cold email. However, I do think it's important to socialize at these communities events and you get to know other groups. Um, Word of mouth and face-to-face introductions make those connections a breeze to create and flourish. So Jane discussed this a little bit earlier on about our Little Free Libraries partnerships, but we partnered with the Florida Department of Health representatives, the Okeechobee County Health Educator, the local school nurse, the agricultural worker service organizations, as well as our main partner, which is the Okeechobee County Public Library. Since we were focusing on community health in this rural area, we really wanted to partner with community members that had more knowledge of the health needs of this community than we did. These little free libraries were placed in parks and other recreational areas, and we wanted to make sure that we actually spoke with representatives from that community to make sure that we had the resources that were needed as well as the best place to put those resources. So talking to someone in that community is very helpful. Okay, so I'm going to talk about some of our other partnerships that the Health Science Center Library has done. So we have our university-based partners. So as I mentioned earlier, check to see how involved your institution is in different community outreach projects. Our university is very involved with community outreach projects. So we have the UF College of Medicine. We had a celebration of Diversity Week. The library collaborated with them 5 years in a row to host a panel to talk about health needs of the LGBTQ plus population. UF Health Street. For that particular organization, the library helped establish a consumer health library. For the UF College of Medicine Equal Access Clinic, we helped provide patient information, handouts, and we also participated in their health fair. Some community-based partnerships that we had include Partnership for Strong Families, where we created resource centers. We also worked with the Alachua County Library District, where we hosted health information workshops, book clubs, film screenings. I believe that was with a particular grant. And with the Pride Community Center of North Central Florida, we participated in Pride Day celebration, where we tabled and we shared consumer health resources. And currently we are working on, we have an NNLM grant to expand the LGBTQ plus health resources at the center. So all good things. And now I'm going to be handing it over to my colleague. So.
All right. So by now, hopefully you've found some sources of information about your community's demographics, because I'm hoping you're all secretly Googling while you're watching this presentation. Go into these resources. Maybe you've learned a little bit more about your community's health status, health resources, information needs, and maybe you've even brainstormed through this list some potential community partners that you could work with. But now we're going to discuss a really common activity that is just almost sort of the bread and butter of our health information outreach, which is training. So why teach, why train? Why is there instruction? Why can't we just buy resources? Well, health information resources are only useful if your users are able to navigate them to find the information they need. And if they have the ability to evaluate health information sources, that's really a key skill set in today's day and age. Lord knows we've got too many people sharing crazy conspiracy theories on the internet related to health information. So, but it's really important to realize that you have a choice about who it is that you're going to teach. If your organization is on the sort of metaphorical front lines and you interact with the public regularly, then yeah, it might be in your best interest to actually host classes and other instructional events with the public, with the actual members of the public. However, it's really important to think about who specifically would be interested in attending your instruction. Is it a group from a local senior center, or maybe an after-school student program, or something else? This is where understanding your community's demographics and health needs can come in handy. But if you're uncertain about who might show up, like if you're just trying to pilot something, you can actually try and gather that information through a registration form. That would be really helpful. Oh, I like Eagle Scout and Rotaries. Yes. Loving that idea. Sorry, monitoring the chat as well. If your organization doesn't generally work directly with the public, like ours doesn't, you might still want to share your expertise. We had expertise, we wanted to share it, but we don't really engage with the public regularly. So we instead go with this train the trainer model of instruction, where you can teach community workers, healthcare providers, others working directly with the public how to teach about health information sources. In these trainings, you not only are teaching about the health information resources themselves, but you also are teaching sort of the teaching techniques and the reference techniques on how to help someone with a health information need, especially if they're maybe a community health worker or a volunteer organization that's staffed by volunteers. They might not get any kind of training on those kinds of things, and that's something you can do. So both models, both legit, very important we think that both are important for ensuring that a community has the skills that it needs to navigate health information. So now that you thought a little bit about who you're going to teach, it's time to think about what you're going to teach. And again, the health information needs assessment is super crucial here in deciding what topics to teach on. However, you sometimes have to balance the specific requests that you get from users with basic foundational concepts to navigating health information. Like, it's so common, I'm sure you guys have experienced it, where your attendees will want you to spend your instructional time just answering a specific health information question rather than teaching the key skills. Like, they have a specific thing that they came there to get their problem solved, and they don't really want to learn skills. They just want to have their problem answered. And that's nice, but we are trying to teach people to fish instead of just giving them fish sometimes. And so you do have to resist the urge to get caught up in the details of a specific request. And you can do this by using examples or test searches that are on the topics of interest, but still demonstrate the important techniques about navigating health information. You also have to choose your content based on how much time you have with your attendees, as well as the format. So for example, if you're hosting an online workshop with multiple meetings, then you might be able to do a more deep dive, detailed exploration of specific sources. Whereas if you've only got sort of a 1 hour, one-shot workshop, you might just need to focus on broad health resources like, of course, Medline Plus. And I mentioned this before because your audience, content, and format, they're all connected and influenced each other. But another key element of designing your instructional activity is to actually think about the specifics of the format. So beyond just the length, you can also think about, like, is this event going to be in person? Is it going to be online? Or is it maybe a hybrid situation? Is it going to be a synchronous event where people all have to show up at the same time, either in person or online? Or is it asynchronous where they can do like a self-paced tutorial, or maybe it's a scavenger hunt? Those kinds of things are self-paced. Or maybe it's just, is it going to be one session, or is it going to be a series like a book club or a journal club? Like, where are we at here? Be pondering these things. Entirely up to you, the resources that you have, the amount of time you have to dedicate, and what you think your audience is interested in, and what's appropriate for you, the content you want to teach. And as always, you should incorporate active learning strategies into your instruction to keep your learners engaged, like hopefully we're doing today with the worksheet. So I'm hoping that you guys have mostly filled out worksheet by this point in the webinar. You can also consider small group activities, or maybe an in-class poll or survey. There's 6 out of those little websites that allow you to do live polling, or you could even just host a group discussion, especially when it comes to people always want to talk about their health situations and their experiences with the healthcare system. There's always somebody who wants to share. And ideally, you'd also want to give your attendees a variety of ways to engage, whether that involves maybe speaking up verbally or maybe typing into a chat box. Just remember that if you're going to give people lots of different ways to engage, you have to monitor all of them. So like, I'm keeping an eye on the chat and also trying to like make sure that no one's trying to unmute themselves and talk, because I want to respect all methods of engagement. And that basically just makes sure that, folks feel heard when they're attending an instruction session. Okay, so we've talked about our identifying our audience. We've talked about figuring out training, all of that kind of stuff. Now let's talk about a different way to engage and disseminate health information. So, because training is just one, so for example, as you saw in our example project, we found that Little Free Libraries were a really innovative way to share health information. It was sort of outside the box. It's really great for you to get creative with brainstorming different ways to incorporate health information into your community. One easy way to do that is to think of the popular community events that are already happening in your area. So this could be events that are hosted by the partners that you've identified. So for example, we partner with the Pride Center. They have a Pride Day where we participate in that event. It's not our event. We're just one of the participants, but that's how we sort of slide into an event that we know is already going to be well attended. You could also have seasonal events. So for example, my mom works in a public library in South Florida, and she actually participates in the community's Dia de los Muertos event where they have the ofrendas and everything. And so she actually highlights a recently deceased children's book author. I think a couple of years ago it was the Llama Llama Red Pajama Lady, and gives away books that are written by that author. And that's how she engages as a public librarian down in South Florida. You could also think about sharing health information tailored to a specific event. So for example, resources about ergonomic workspaces at a benefits fair, for example. And of course, if you're not representing a library yourself, always remember that library-based events like story times and author signings are a good opportunity to share health information. Basically, just take advantage of the fact that people are already gathering to get the word out. In addition to pre-existing events, you can take advantage of pre-existing community gathering places as a means of sharing health information. So for example, have you thought about putting up a display sharing resources about sun safety at the local playground or park? Again, this can tie into your potential community partners. You can ask if your partner will let you share brochures or bookmarks about health information resources in their space, like a church foyer or a community center bulletin board. You could even temporarily table outside local businesses, the way that Girl Scouts and other charities often can be found outside of grocery stores or malls. And don't forget about online gathering places. Is there an employee listserv where all the latest gossip is shared, or maybe a word of mouth Facebook group where you can start a discussion? So again, go where the people have already gathered. And then finally, passive dissemination. This is basically, you might not even have to develop a sort of a separate health specific event. Instead, you just can incorporate elements of health information into your organization's sort of regular programming. If you're concerned about your level of expertise, you can always invite guest speakers from local health department or healthcare provider to speak on topics of interest. You could also host book clubs on health-related books. The network of the National Library of Medicine has a website with a list of health-related books with discussion guides and promotional materials included. For those less inclined to read, you could host a movie with health-related themes and then hold a moderated discussion afterwards to inspire interest in health resources. And of course, as we approach these lovely winter months, well, at least down here in Florida, you can take advantage of the cooler weather to host an outdoor event. And then finally, this is a reminder that you don't always have to be actively engaged in health information programming. Sometimes your users would prefer to have the opportunity to explore health information resources privately on their own time. This is where passive programming like book displays, bookmarks, and brochures, as well as social media messaging, can really make a difference and remind your users about the resources that you have available. You can also take advantage of the National Library of Medicine's Traveling Exhibition Program. They have professionally researched and curated exhibits on various history of medicine topics, and you can actually request to temporarily host one in your space for just the cost of shipping. So highly recommend that as like built-in passive programming. And so finally, just thank you so much for listening. Please contact us if you have any questions, and of course, we're available to take questions now. And I'm going to just stop the share so we can see each other's shining faces.
Yes, thank you so much. That was great. Do any of our audience members have any questions? Thus far, I haven't seen any in the chat, but now is your time to get those questions answered if you have anything on your mind.
I'm also just noticing in the chat about the gold awards for GS, the social emotional learning booklet. I love this. I love the ideas. You guys type your ideas in the chat, man. Like share, like brainstorming creative ways where we can be a fountain of information.
Yes, well, we already have a compliment here from Jennifer who loves the concept.
And Liz says sometimes hospitals will also do outreach and look for partners or ways to connect positively with the public. USA did a flower mart every year, and that was a big draw for people. Really excellent time to share information. Thanks, Liz.
Yeah, if somebody has a question, just go ahead and put it here in the chat. Okay, Eric asked, what do you recommend for we who work in the public health department to approach our county public libraries to partner?
That's such a good question. I feel like one of the easiest and earliest things is honestly offer free programming. Say, we have a workshop we'd love to host. Libraries love hosting programming. It makes them seem more relevant and like a good benefit to their municipalities and their taxpayers. So if you just literally say, hey, can I use your meeting space to host a workshop? Like, I've never heard of a library saying no to that. They love free programming that will get people in the library. That's like the simplest way to start. And then once you've sort of built that trust and made that connection, then you can start brainstorming with the librarians. I will say that different public libraries have different levels of comfort with dealing with health information. So it's definitely see where they're at, see how they feel about it. Some of them get very spooked off with the whole like, I'm not a doctor. But yeah, definitely public libraries are always asking. They love author signings. They love, having healthcare providers talk. It's one of their favorite things.
Then we have another question. They're saying that they're starting a proactive health management startup company and have 2 publications available about healthcare costs and brain health. She's wondering what community resources she could connect with to promote that health information. But she thought libraries would be a good start there.
Yeah, libraries would be a good start. And I just wanted to really quickly respond to the question about how to get the Little Free Libraries built. So with the Okeechobee County Library Project, they were actually partnered with some local builders who were really interested in doing work for the local community. So that's how they got the boxes actually built and the resources supplied in terms of the wood and things like that. So that was a great start for this project.
Yeah, my mother's library also does Little Free Libraries, and she honestly has a lot of them sponsored by local businesses. Essential to making sure that Little Free Libraries don't become an eyesore is making sure you have a sponsor, somebody whose job it is to check them and make sure that they're clean and constantly refilled with materials, because otherwise they can just become a place where things nest. So definitely need a little bit of maintenance.
Yeah, and as April mentioned, you can check out NNLM for funding to purchase or build one. Our website's nnlm.gov. You can also just go to the website and check for your appropriate region.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.